Hello, everybody. It's good morning from the Oxford and good afternoon in Bali. I'm so sorry that I cannot be there in person. Can you hear me okay?
Yes, yes.
All right, thank you. And very interesting, Melanie, on the presentation. I found a lot of things to learn. And it's actually is very, very uh, interesting topics about the rehabilitation and how we can use the technology to uh, um, provide a better care for patient in the rehabilitation of stroke. And I'm going to share my screen and my talk means briefly gives you an idea of what is the digital technology can provide in terms of supporting for stroke patient and stroke care. Can you see my screen? I'm sharing my screen now. Okay. Can you see my screen?
Yeah, yeah.
Okay. Thank you. And a bit about myself. So my name is Minh Chen. I am in the University of Oxford, but I am training as engineering in the background. I was doing most of the work related to engineering work, making device, create product to support doctor and healthcare people. And my goal is to create the UK connections between the countries like Vietnam and also promoting the connection between economic and research. Uh, my motivation is really, really hopeful and expecting to solve the healthcare problem using technology. I would love to support the doctor and patients also addressing the human healthcare problem using technology. And I believe that technology can solve and unlock many potential of the human behavior. If we're looking at the world right now, you can see the problems become more challenging and it requires a collaboration of many, many people working in multidisciplinary and many, many fields. For example, the problems that we are sitting right now, we are talking about stroke. Stroke care can related to people who already been uh, working with patients, for example, doctor, nurses, and also people who take care of patients, like people who are working related in the very close field. And the reason why I brought in this slide in is the problems that we're facing right now is more and more challenging, and we need the support from each other, and we also come all together to solve big problems. Uh, the one that I keen on showing you today is something called digital medicine. It is a center and it's a little bit smaller than the digital health. Digital health is covered a little bit further and more extreme. But in digital medicine, you can think about like that. Anything related to medicine that the doctor use to take care of the patient, applying technologies inside it can be considered as a digital medicine. It can cover across from the evidence that you using AI tool to generate the analysis, or you can using apply the big data to process the data that you have been acquired, and you also using this technology to bring in to come up with some solution to take care of people, as in moving that on to predict some patient have some outcome or the patient has going to go into this route of treatment, or we call digital therapeutics, applying any technologies like an app for the patient doing recording the recovery process can be considered as a digital medicine. Okay, so the problem will be the I introduced you to the technologies. that I have been talking about, and now go closer a little bit talking about the digital medicine for stroke care. And the way how I constructed it is I break it down into some of the pictures you might see very familiar. And it's also actually the protocol that you have to facing in every day if you treatment for stroke. First one is the stroke onset. Calling an emergency is just an analog transports the patient to the closest hospital, try to analyze and try to find if the patient have some severe symptom of stroke to provide with the critical care and also do some treatments for recovery in the hospital. And also at the end, you discharge the patient and following up the patient in the home care setting for the rehabilitation. All of this process can be applied in the digital technology, and I believe that the technology is going to have the doctor save more time and see more patients. Right. It's still quite big to say, right, how the technology can support it here, but I break it down into smaller and smaller chunks, and I'm going to show you here. The challenge that we face, I will take an example of the Vietnamese challenges. And one of the problems that we're facing is Vietnam, the length of the Vietnam, which is I'm coming from, is neighbor, and uh, is very, very long country. From the north to the south is even uh, from the north point to the south point of Vietnam is longer than the road trip from flying from London to Rome. So you can imagine that to process or providing the guideline for stroke care in Vietnam is quite difficult. And it's also challenging because all of the process, when they call the ambulance arrive and the ambulance come into the hospital is all used by the road, and the roads in Vietnam has been constructed and is not been very moderated well. So the ambulance have to be finding the uh, very, very difficulty to moving the patient. We don't have any kind of uh, airline helicopter or airline. They just the new concept to Vietnam. And the problem of the Vietnam is like that the patient will not go into the hospital on time. The the solution for that in the paper, according to our research, is showing they have a couple of possibilities that we can solve the problem. The first solution is we need to double the stroke care unit in Vietnam. Right, it's now impossible because right now they are having 200 stroke care center across Vietnam, and in the paper we are expecting to double that. So to solve the problem of stroke care in Vietnam as a general. And the second solution that coming up on the analysis paper is was using technologies, so digital technology to solve the shock care problem in Vietnam. So here's how I'm going to provide you with some guidelines that we've been working together on the paper to provide a better care uh, in Vietnam and also for the technologies. Um, Component, I break it down into some components for emergency stroke care. First one is a stroke registry. You need to have some paper inform and digital technology to support the patient to move things faster and come across between patient to patient and also hospital to hospital. So when the patient arrive and when they move to the second hospital, they are still in the very quick action to process the public awareness and the public education. I think that's one key to note down and to showing the patients to introduce the concept of shock to the mass varieties of the population. People will aware of that, people know where to go, and people understand what is the process. so they will reduce complexity and also the confusions when they happen into the critical situation. Um, Early recognition and rapid timing delivering time is also really, really key important. That I'm going to tell you in the next slide about the technologies. People have been done that before, people in applying it, and the people has been see some research and also some outcome out of it. Technology is accountable and also some culture experience is also very, very different to taking the solution from one country to apply to another country due to the complexity and also the cultural experience. People difference and also the perspective of people also different. Expectation of them will be challenging. Here is some say case and also some projects that have been done before, and I hope this can give you some idea and concept of what technologies can be introduced and applied in solving the stroke care and stroke pathway. First one is telemedicine. When everything's linked together, the patients arrive to the hospital, in the hospital, and also monitor after discharge. They have been putting together by layer. But this one is an umbrella project, which has been well uh, recognized and putting together in the mainland Europeans. It links on the healthcare worker putting in the shock area together to provide patient with the better support. You can see here they have been different layer of decision and also different layer of providing people input to make sure that the process goes smoother. And I believe that telemedicine provide a fast track and it's also uh, supports for the stroke patient, enables the remote consultancy and they reducing the time for treatment. Another project is an app also developed in the mainland Europe. It's been well connect to people who may want to understand about shock, people who are working on shock, and people who actually treatments for patients with shock. So everything's linked together in the mobile phone app, and the patient can have the concept, and also relative of the patient have the concept of the shock, where to go, where they can have some idea and also understanding about the pathway. Um, in the UK, the concept of the mobile healthcare hospital unit, the EMS, sorry, the mobile stroke unit has been introduced in 2002 and it has been well established and it's been used in couple of areas in the UK. So the idea is, right, instead of you bringing the patient to the hospital, so they're going to bring the hospital to the patient. They establish the mobile stroke unit, which is in the set of the van contains all the equipments to diagnose the stroke into a mobile unit, and they can drive it closer and find a better um, pos uh, position, better location that they can see the patient as soon as possible. And also they provide a better outcome of the patient who has been seeing in the um, mobile stroke unit, showing the better recovery of the 90 days MRS score compared with the standard emergency medical service standard. It's also the concept of like technologies wearable and technology is bringable, that they can bring the whole hospital and talk to the patient to make the process moving faster. Last but not least, that I really keen to talk about and introduce about is stroke care rehabilitation, which Melanie has already been giving you the the idea of how uh, Oxford people we have been researched in rehabilitation of insomnia with stroke patient. I really want to highlight that in the developing country, we just after discharging the patient, um, we need to pay more attention about the life quality and also the rehabilitation process of the patient. They have couple of research has been showing the technologies when you monitoring patient after discharge regularly, you can increase the quality of life and also reduce up the traumatic post-traumatic mental health disorder. The also by the concept of the virtual reality in shock rehabilitation is also has been introduced and it's been working quite a while and I see the potential of that coming into the developing uh, better guideline for the patient who have stroke before. The good there's a benefit of the virtual reality is that you can send the patient home with the kit and they can do the rehabilitation remotely with some record or some training from the doctor. And that's also been helping to improve the quality of life, reducing the stress for the hospital. The patient will not have to come back to the hospital, but they can see not they can seek for the consultants of the expertise in the local area. And thank you very much. So that is the end of my presentation, and I hope it can give you the briefly idea of what digital technology can help to improve the stroke care. Thank you.